Today we'll be going over the Embrace Clinic's steps and instructions for a medical abortion. Start by taking your prescription to the Wellness Pharmacy located on 13737 96th Avenue, Surrey. At the pharmacy, you will pick up 2 prescriptions. The first is for mifenymiso. These pills come in a green and orange box. Additionally, you may have to pick up other medications recommended or prescribed to you at today's visit. On the first day, swallow 1 mifepristone pill. This pill comes in the green box. Its role is to stop the pregnancy from growing, and it is not reversible. Most people do not have side effects. However, both bleeding and not having any bleeding are both common. For day 2, which is 24 to 48 hours after day 1, take the day off of school or work and have a support person nearby. Take pain medication and nausea medications 30 minutes before taking the next medication. You can take 600 milligrams of ibuprofen. Additionally, if you are nauseous, you can take over-the-counter anti-nausea medication, for example, Gravol. Next, in your cheeks, melt all 4 pills of misoprostol, which comes from the orange box. Let the pills melt for around 30 minutes. After 30 minutes, you can swallow whatever is left over. After taking this medication, you may have nausea, vomiting, diarrhea, or shivers. These are normal symptoms, but should last less than 24 hours. Heavy bleeding and cramping will start between 30 minutes and 6 hours after the second medication. You may see blood clots and tissues. Use maxi pads and do not use tampons or a menstrual cup. For pain, use a heating pad, rest, and massage. You can also take 400 to 600 milligrams of ibuprofen every 6 hours with food as needed. The pain will get better after the pregnancy has passed. For follow-up, you will have a phone appointment 1 to 3 days after the medications. You will also need to get lab work done 7 days after the first step. It is important that you do the follow-up blood work to make sure that you are no longer pregnant and that no tissues remain and there are no health concerns. Call the clinic or the after-hours nurse practitioner if you experience any of the following: if bleeding has not started within 24 hours after the second medication, if a mild fever, nausea, vomiting, and diarrhea from the misoprostol do not go away within 24 hours, or if you have a bad smell or pus-like vaginal discharge. Go to the emergency department if you experience any of the following. The first is too much bleeding. This includes filling and soaking through 2 regular menstrual pads per hour for 2 hours in a row and still continuing to bleed. Go to the emergency department if you experience passing clots larger than the size of a lemon. Additionally, go if the pain is severe and not getting better with medication, or if the pain is on one side, is severe and you have shoulder pain, or if it lasts for longer than 24 hours. Additionally, go to the emergency room if you experience a fever with a temperature over 38 degrees Celsius or 100.4 degrees Fahrenheit for 6 hours or more. In some instances, patients may need to go for a surgical therapeutic abortion. It is essential that you follow up with the blood work and the clinic in order to make sure that the process has gone correctly. Additionally, you may notice some bleeding or spotting between now and your next period, which should occur between 4 and 6 weeks from now. Additionally, it is still possible to get pregnant again between now and the next period. It is important to consider some contraceptive options between now and your next period. If you have any further questions, feel free to phone the clinic for more information.